women cry tears of relief in my doctor's office all of the time. I'm Jay Vintage. I'm a board certified family medicine physician. And one thing has been apparent. If you can actually provide women relief by acknowledging and understanding conditions that many doctors think are fake, and you can understand what a workup could look like and what treatment could look like, and create a win-win-win situation, you will never go out of business. You will provide so much relief to your patients. You will love what you do for a living, and you will continue to grow. And this is something that I do all the time. So there's a lot of women that will end up, and by the way, I say women, this does happen to men too, but these conditions disproportionately affect women. So you have women that come with some concerns about mood swings, anxiety that normal meds don't do a good job taking care of, vaginal symptoms, spotting periods, cramps, pain in their body, interstitial cystitis-like things, which feels like chronic urinary tract infections, IBS, fibromyalgia type things. They end up going to their primary care doctor. Their primary care doctor does blood work. The blood work shows as normal. So the primary care doctor sends them to a specialist. The specialist says, I guess we could do a cystoscopy, or I guess I could put a camera in your colon. And then they find out that everything's normal there. They send them back to the primary care doctor. And the primary care doctor goes, well, I guess it's all in your head. Or they'll say like, well, I guess it could be perimenopause, but I don't have anything for you. Nope. We do things completely different at our direct primary care clinic in Oklahoma City. The first thing that taking care of these folks requires is knowing how the conditions generally work, how some of the symptoms cluster, and recognize that this is happening all over our population. Okay, the other thing is that you need time to be able to spend with the patient. That's exactly why I did direct primary care. I'm not somebody that likes to do these 15-minute visits, make a bunch of assumptions, and then 2 years later, you're still trying to figure out what's going on. In my clinic, it's something that I spend sometimes 1 to 2 hours with each and every single new patient, which is why it takes a while for new patients to get in. But once they're plugged in, they have access to me, right? Same day, next day visits, and they can call me and they can text me, and I can fill meds at the site of the location. They can literally pick up their medications 24/7. We don't carry the controlled meds because there's a lot of red tape there. But the point is that when women finally hear from a doctor, hey, listen, I know you've convinced yourself you're not nuts, but you need to hear it from me. You are not crazy. I believe you. Your lived experience is valid, and we're about to come up with a plan that nobody else has been able to come up with, and you will see some sort of relief. The tears flow. That's why we order Kleenex boxes. I'm glad it's a business write-off, because we're able to take care of our patients. Our patients are able to take care of us, and we are able to contribute to improving the medical system, not making it worse.